Hello everyone, welcome back to my YouTube channel. This is Navdeep Kaur, Registered Nurse Division 1 from Australia again. And I would like to say hi and hello to everybody who is watching this presentation from within Australia or outside Australia. ਸਾਰਿਆਂ ਨੂੰ ਮੇਰੀ ਪਿਆਰ ਭਰੀ ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਤੇ ਮੈਂ ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ਇਹ ਵੀਡੀਓ ਦੁਬਾਰਾ ਤੋਂ CPDs ਦੇ ਬਾਰੇ ਦੱਸਣ ਦੇ ਲਈ ਇਸ ਕਰਕੇ ਲੈ ਕੇ ਆਈ ਹਾਂ ਕਿਉਂਕਿ ਲਾਸਟ ਵੀਡੀਓ ਜਿਹੜੀ ਮੈਂ CPD ਦੇ ਰਿਗਾਰਡਿੰਗ ਪਾਈ ਸੀ ਉਹਦੇ ਵਿੱਚ ਮੈਨੂੰ ਇੱਕ ਪਰਸਨ ਨੇ ਕੁਐਸਚਨ ਪੁੱਛਿਆ ਸੀ ਕਿ ਆਪਾਂ ਨੂੰ ਕੀ ਐਵੀਡੈਂਸ ਰੱਖਣੀ ਪੈਂਦੀ ਹੈ CPD ਦੀ ਕੀ ਐਵੀਡੈਂਸ ਆਪਾਂ ਰੱਖਾਂਗੇ ਔਰ ਕਿੰਨੀ ਦੇਰ ਲਈ ਰੱਖਾਂਗੇ So the burning question is for how long we are meant to keep the evidence of CPD, and do we really need to keep an evidence, and what would be the evidence, right? So CPD is something which we all know that we have to do 20 years of CPD. I'm talking about registered nurses here. There can be different requirements if you have additional endorsements with APRA. ਜਿਵੇਂ ਕੁਛ ਲੋਕ RNs ਹੁੰਦੇ ਨੇ, ਕੁਛ ਨਾਲ midwives ਹੁੰਦੇ ਨੇ ਔਰ ਕਿਸੇ ਕੋਲ scheduled drugs ਦੀ endorsement ਹੁੰਦੀ ਆ, ਕੁਛ nurse practitioners ਹੁੰਦੇ ਨੇ. So you need to familiarize yourself with all these different designations and all these different endorsements with APRA or NMBA. So they might have additional CPD requirements that I have clarified in the last video. In this particular video, I am going to focus on what CPD evidences are required, why do we need to keep the CPD evidence, and for how long we are going to keep the evidence of CPD. So what basically CPD is, it's continuous professional development, which means ke ek wari ਆਪਾਂ ਨੂੰ nursing ਦੀ registration ਮਿਲ ਜਾਂਦੀ ਆ ਉਸ ਤੋਂ ਬਾਅਦ ਆਪਾਂ ਨੂੰ ਇਹ ਹਰ ਸਾਲ ਡਿਕਲੇਅਰ ਕਰਨਾ ਪੈਂਦਾ ਜਦੋਂ ਵੀ ਆਪਾਂ ਆਪਣਾ ਲਾਇਸੈਂਸ ਰੀਨਿਊ ਕਰਨਾ we need to renew every year that we are complying with the CPD standard. There are different standards. CPD standard is one of them. So we have to declare basically every year that we are fulfilling this standard of continuous professional development. And how are we doing this continuous professional development? It's not like once you are registered as a nurse, it's done and dusted. You don't have to keep yourself up to date. It's not like that. You have to keep yourself up to date with the topics, with the improvements, with the advancements that are happening in your profession, because you want to stay on the top of everything. In Australia, people, general public, is very much educated about all the topics, be it COVID-19, be it vaccinations, be it any general practice topics. They are very much up to date on anything. So being registered health professionals, we have to stay on top of that information that's available on Google, because everybody nowadays goes to Dr. Google, and Dr. Google is not always right. We all know that. So we as registered health professionals have to have some authentic knowledge from authentic sources, primary sources of information, not from WhatsApp, not from Facebook. So that is called a continuous professional development, where we go back into our literature, we go back into our evidence-based practice so as to maintain the knowledge, improve or broaden our knowledge, expertise and competence, and develop the personal and professional qualities required throughout our professional lives. That is what is called a continuous professional development, which means learning never stops. Once you are registered as a nurse, that doesn't mean your books are closed. Your books remain open throughout your nursing career. That is what it means, which is good for us, which is good for our general public, and it is a very good way of keeping your learning up to date. So as per CPD standard from NMBA, which was last updated on 1st of June 2016, we don't have to show our 20 hours of CPD when we are initially applying for registration. You know, when ਜਦੋਂ ਆਪਾਂ ਪਹਿਲੀ ਵਾਰ ਅਪਲਾਈ ਕਰਦੇ ਹਾਂ ਲਾਇਸੈਂਸ ਦੇ ਲਈ, ਜਦੋਂ ਆਪਾਂ ਹਾਲੇ ਸਿਰਫ ਓਵਰਸੀਜ਼ ਤੋਂ ਆਏ ਆ ਜਾਂ ਫਿਰ ਆਪਾਂ ਹਜੇ ਇਨੀਸ਼ੀਅਲ ਸਟੱਡੀ ਕੰਪਲੀਟ ਕੀਤੀ ਆ ਆਪਣੀ ਨਰਸਿੰਗ ਦੀ ਔਰ ਆਪਾਂ ਫਸਟ ਟਾਈਮ ਨਰਸਿੰਗ ਦਾ ਲਾਇਸੈਂਸ ਲੈਣ ਲੱਗੇ ਆ ਜਦੋਂ ਆਸਟ੍ਰੇਲੀਆ ਦੇ ਵਿੱਚ, ਉਦੋਂ ਆਪਾਂ ਨੂੰ ਇਹ 20 ਆਵਰਸ ਸ਼ੋ ਨਹੀਂ ਕਰਨੇ ਪੈਂਦੇ। ਬਟ ਆਫਟਰ ਦੈਟ ਜਦੋਂ ਆਪਾਂ ਹਰ ਸਾਲ ਉਹਨੂੰ ਰੀਨਿਊ ਕਰਦੇ ਆ, then you have to show your 20 hours, minimum 20 hours. It's up to you. If you are a very nice, good, knowledgeable nurse, you might have more than 20 hours. It's totally up to you, but minimum 20 hours is the requirement from the national board. ਸੋ ਐਵਰੀ ਈਅਰ ਜਦੋਂ ਆਪਾਂ ਆਪਣੀ ਰਜਿਸਟ੍ਰੇਸ਼ਨ ਨੂੰ ਰੀਨਿਊ ਕਰਦੇ ਹਾਂ, ਆਪਾਂ ਇੱਕ ਡੈਕਲੇਰੇਸ਼ਨ ਦੇ ਉੱਤੇ ਟਿਕ ਕਰਦੇ ਹਾਂ। ਔਨਲਾਈਨ ਰੀਨਿਊਅਲ ਹੁੰਦਾ ਆ ਹਰ ਸਾਲ। 31 ਮਈ ਡੈਡਲਾਈਨ ਹੁੰਦੀ ਆ। 31 May is the deadline for renewing your nursing registration in Australia. So that's when you declare that yes, I have completed this 20 hours requirement, or I have complied with this standard. So why do we need to comply with this standard? One thing is it's for our own good, because we want to be knowledgeable nurses. Another reason is the audit. You can be audited anytime. National board can audit you anytime. You can be asked to present your CPD portfolio or evidences that yes, you have done some upgrade to your knowledge. So another reason can be if the national board, the Nurses and Midwifery Board of Australia, NMBA, which is falling under APRA only, if APRA receives a notification about you, notification could be a complaint, right? If somebody is suspecting that you are not keeping your CPDs up to date but are practicing as a registered nurse in Australia, then they may send you a notification to present the evidence that you have done or met this standard. So what is the evidence that we need to keep? You need to maintain the records of your CPD activity for 5 years, which means 5 ਸਾਲਾਂ ਤੱਕ ਦਾ ਆਪਣੇ ਕੋਲ, ਲਾਸਟ 5 ਸਾਲਾਂ ਤੱਕ ਦਾ ਆਪਣੇ ਕੋਲ ਰਿਕਾਰਡ ਹੋਣਾ ਚਾਹੀਦਾ ਆ ਕਿ ਪਿਛਲੇ 5 ਸਾਲਾਂ ਦੇ ਵਿੱਚ ਆਪਾਂ ਕੀ CPD ਐਕਟੀਵਿਟੀਜ਼ ਕੀਤੀਆਂ, right? You can make a personal CPD portfolio as well. Portfolio is just, you all know what is a portfolio. It's like a list of all CPDs that you have done, right? So you have to show that evidence for at least the last 5 years of your practice. You can be asked for last 5 years. If you have been practicing as a nurse from last 10 years, they won't ask you for last 10 years of record. The minimum they can ask you is, or the maximum they can ask you is for 5 years. That's what it says in the standard. So there is a beautiful way of explaining it. How do we actually proceed about CPD? So like starting from a new CPD cycle, which means from 1st of June to 31st of May is the time period, is the year of registration that is considered in Australia, starting from 1st of June till 31st of May next year. 31st of May is the deadline of renewing your registration. So you are supposed to meet all the standards of your registration in that 1 year, starting from 1st of June to 31st of May next year. So when you start with the new CPD cycle, which means every year from 1st of June, when your new registration period begins, you should start thinking of what is my target of CPDs this year. For that, you need to go back and look at your registration status. If you are a registered nurse, what is your requirement? If you are a registered midwife, what is your requirement? If you are a nurse practitioner, what is your requirement? If you are a registered nurse endorsed to give some medications, schedule drugs or anything, what is your requirement? So you need to go back, check your registration status, and from there you need to check what is my CPD requirement. Usually it doesn't change every year, but still it's your obligation, it's your professional obligation to check what is the requirement you are supposed to meet. Then you need to develop a learning plan after that. Learning plan means, what do you think you need to update your clinical practice on? For example, if I'm working in oncology, I would rather choose to um, update my knowledge on some chemotherapy or radiotherapy or certain medication side effects, etc. I will not go and up to date my knowledge about, um, say, pregnancy and labor, because that is not my context of practice. I am practicing in oncology. I'm giving an example of oncology. So I would take a topic related to my context of practice. Because whenever we renew our registration, there are questions. What was your main area of practice in the last period of registration? So your CPDs should be linked, should be clinically connected and relevant to your clinical context of practice. Then after that, you undertake some CPD activities. CPD activities could be, maybe you have chosen to upgrade your qualification. You have enrolled into a postgraduate course, or you have attended some seminar, or there was a workshop, or there were some conferences, or you have done some self-directed, self-paced learning, anything. And then you have to maintain a portfolio for that whole year. You have done 7 CPDs, you have done 6 CPDs, whatever CPDs you have done, you have to maintain a portfolio. And then once your 20 hours are met, good to go. You can renew your registration. And like I said before, 31st May every year is the last date of renewing your registration. And then from 1st June onwards, your new CPD cycle begins. Every year, I'm an RN, so I'll talk about RNs here. So you need to show that you have done 20 hours of professional development courses or something every year. So there are some examples here. What CPD activities we can choose? We can enroll into some postgraduate studies. It could be anything. Like, I'll give you my example. I'm currently doing a certificate for in training and assessment. That can be my CPD because I love teaching. I love talking, as you can see. So it's up to you. Like, it should be linked to your profession, right? We all need nurse educators. So that is definitely linked to my profession, and I'm practicing into community as a district nurse, and I always have nursing students with me, sometimes budding with me with my during my shift. So teaching learning is part of my job, so it's related to my job role, and I have enrolled into that. So that is my CPD for this year. It can be participating in the journal clubs. It could be any in-service education, like the company I work with as a district nurse, they offer in-service education into catheter management in community, diabetes management in community, continence management in community. So these kind of topics are in-service education topics. Then you can attend some conferences, workshops, seminars, like um, recently we attended a seminar that was related to different dressing products, and it was organized by a company that designs all those wound products in Australia. So if you go there, they give you some lovely free samples of dressings as well. So that is additional benefit. And in the end, you get certificate of attendance. So that is also a CPD activity. Another example could be authoring a book chapter or having an article published in a peer-reviewed journal. Now this one, I've taken a web shot. So as per an MBA, they have given, this is an example, they have given us a template. It's not mandatory to use this template to record your CPD portfolio, but this can be taken as an example. Like, this is what they want, this is what information they are after whenever you are renewing your CPD. Like, here is a very good example. You have to write the date of when you have done that CPD. Then you write the source or provider details. Here it says an MBA, but it can be anything. For example, if you have done self-directed learning from Asthma Australia website, there are a lot of self-directed learning opportunities for health professionals there. So you can write the source is Asthma Australia, right? Then identify learning needs. Here you have to write why you have chosen this topic. Here you need to write, for example, um, you work with the, like I would say I work with in community, and I would like to upgrade my knowledge on asthma medications. That's why I've chosen, because I see a lot of patients in the community who are on asthma medications, and in Australia thunderstorm asthma events are really bad. So I wanted to upgrade my knowledge on asthma, and I've chosen this topic. So this could be your learning need. And then action plan. Action plan means what actually you're looking for in that topic. What was your plan of action? Like I would say, understanding about asthma, understanding the pathophysiology, then understanding various different types of medications, their mechanism of action. All these things can be my action plan. Type of activity, yes, it was a self-directed learning because I chose to do it from Asthma Australia website. Then description of the topic covered during that activity. You will write a little bit of description about that topic. You don't have to write the whole topic here, just a bit of gist about that topic. What was that topic about? And then reflection on your activity. What have you learned? What have you achieved by doing that course? And then you have to write number or title or description of the evidence provided. So if you don't have an attendance certificate, you can just write that this CPD evidence record is the evidence, just a portfolio. If you have a certificate, then you can say I got a certificate of attendance, or I got certificate of attainment, because certain self-directed learning have a short quiz after each topic is finished, and then you get certificate of attainment with each topic advancing. So you can write that there, and you can keep those certificates as the evidence. And then you have to write CPD hours. How many hours was the CPD activity? So generally every CPD activity will tell you that how long it's gonna take. So every organization, whichever you are choosing to do your CPD activity from, they actually tell you beforehand how many hours CPD you can claim after this course. So in this example it says 4 hours. It could be 6 hours, it could be 2 hours. So in that 1 year of period of registration, you need to make 20 hours of CPDs. It could be 6 different topics. It could be 7, 8, 10. It's up to you how many you're able to do. Here is the blank template. That is the same template, but it's blank. Example. And this was an example, whereas this is a blank one. You can fill your own template. Again, I'm saying that this is an example of a template given by NMBA. It's not mandatory to use this particular template. You can have your own template. But this is the information they are after. So you need to provide the information as highlighted in this template, but not necessarily using this template. Now, what sort of evidence we need to keep? So there is certificates of attainment or any certificates of attendance. You need to keep them for 5 years if you have them. Some courses will have the certificate, some courses will not have the certificate, but you can still claim or document it and include that in your portfolio. Then there could be some notes from some self-directed CPD activity that you have done, such as a literature review or case study or any journal articles you have read. You can keep a copy of that article to show as a proof that you have actually read this article on so and so date, and you obviously include the information in your portfolio as well. So portfolio is separate from your certificates. Your certificates will be kept separately, and your portfolio, your list of CPDs throughout the year would be a different document, and you can use the template that I've shown you before. Now, next thing is, this question was in my mind when I started practicing as well. and now it's clear after I've taken the web shot of this question from an MBA fact sheet which was renewed in March 2022. You know how in Australia we are doing mandatory learning every year at every workplace, whether you are working in a hospital or aged care or practice nursing or community nursing, wherever you're working, there are some mandatory learning modules that we are doing every year, and CPR is one of them. Every year we have to have CPR training. Every year we do a refresher course on that. Similarly, we have hand hygiene, infection control, recognizing a deteriorating patient, and the list goes on. So there are some mandatory training modules that we do every year. Can we actually consider them into our CPD hours every year? What do you reckon? Obviously no, because why? Why? The reason is every year we can't claim same learning into our CPD activity. You know, CPR was done last year and you are doing CPR refresher again this year. This is not something new. This is just a refresher, a build up on your old learning. You know, you have to include something new. For example, here they've given you an answer very beautifully here. See, we read the question first. Can I claim my CPR or fire training that I have to do at work as CPD activities? So here it says mandatory learning activities in the workplace can only be counted as CPD provided that they are relevant to your context of practice and where they include new learning. So if it is not any new learning, it is just a, you are revising it, then it can't be claimed into a CPD. For example, routine annual CPR and fire training education cannot be counted. I read it again. Routine annual CPR and fire training education cannot be counted. However, if there is something new in the mandatory learning area, such as COVID-19 pandemic education and training in the initial stages of the pandemic, then this could be claimed. But now that can't be claimed because COVID-19 pandemic new information also is now over. Pandemic is not over, but the new information is over because now everybody is aware about COVID-19. So basically, our mandatory training cannot be claimed every year into our CPD activities. It has to be something new. It's annoying, but it's true. All good. So I would say a big thank you to everyone, and thank you for whoever asked me this question on my last video. That gave me an idea for my next video. For those who haven't liked or subscribed yet to my channel, please do so. So keep me motivated. I will keep putting new videos in the future. Till then, thank you and bye-bye.